A very pleasant good afternoon to all of our viewers. We are delighted to be with you. We are sorry for the delay, but we will make up the time. That's okay. This afternoon, we are here again to continue another Let's Talk. We had just a little mix up with respect to the time difference. Sorry for the delay. Okay, let's try this again. We did have a little mix up with the time difference, but that is sorted. And we're going to get going right now. With us this afternoon, we have, again, Dr. Brown. Dr. Brown, we are delighted to have you.
Thanks for having me.
Okay, I'm getting a little feedback. I will solve that problem in a minute. Okay, wonderful. Still having just a little. Okay. Okay, Dr. Brown, good afternoon again. Welcome. For those of our viewers who are joining us for the first time, I am delighted to let you know that we have been talking with Dr. Samuel Brown from Brown Fertility. Dr. Brown completed his reproductive endocrinology and infertility fellowship at the renowned Jones Institute. And he has been guiding us through this whole issue of infertility treatment and issues relating to artificial insemination and the like. And we had truly an inspiring discussion last week, and we are going to be continuing this week.
Thanks for having me, Dr. Greene.
I am still, my apologies to our viewers. We're still getting a little feedback here, at least I am. So let me try to see if that should
sounds good on this end.
All right, wonderful. Well, Dr. Brown, I want to begin by just expressing delight in your presentations last week. You know, during the course of the week, I had so many feedback, so many individuals have expressed their gratitude, their appreciation. But there's one thing we did not do last week. I did not ask you, how can people contact you if they need to?
Sure, thanks, Dr. Greene. We're easy to contact. We're in Florida. We have multiple locations in Orlando and Jacksonville, but you can actually just go on our website, www.brownfertility.org or brownfertility.com. So either way, you can get in that way, or you can call our office. It's in the United States, it's area code 904-260-0352. And we would be happy to establish a telemedicine consult with anywhere in the world very easily by Zoom connection, just like this. Thank you.
Okay, wonderful. Now we have a few outstanding questions from last week's program, but before we go into those, I suppose there are a few persons joining us for the first time, or you know, who may have missed last week. Can you just give us a brief summary of what fertility treatment is all about, Dr. Brown?
Sure, thanks, Dr. Greene. So in general, what is infertility? For couples that are trying to conceive, especially in a heterosexual relationship with a man and a woman, if the woman's 35 or under, if they've had just 12 months of random intercourse, doesn't even have to be targeted intercourse, just random sex, the woman should conceive. If she does not conceive, then that's the definition of infertility. And then they need help, and we can usually help them. Now, if the woman's between the age of 35 and 40, just 6 months of unprotected intercourse, and if there's no conception, then we consider that infertility. And for couples where the woman's 40 and above, basically they can contact us immediately to start talking about how to help them conceive, because time is of the essence in that age group. So that's the definition of infertility. And our goal as board certified fertility doctors is what's the fastest yet cheapest way to have success and have a beautiful baby and family. So that's our goal.
Okay, wonderful. Well, we have established the fact that a married couple can use the technology to delay pregnancy, can plan for a child after chemotherapy. Last week, you indicated that individuals who are having chemotherapy treatment will
Yeah.
be permanently affected. And we spoke about that last week. We can also allow for fertilization to take place when the natural methods cannot work. Last week, you indicated that a physician, as a physician rather, you have a choice in determining if you will do a procedure or not. What are some of the reasons that would cause you not to take a patient?
Sure, it's a good question. You know, as fertility doctors, we generally follow a code of ethics and morals, and that's related to our society, the American Society for Reproductive Medicine, or in Europe, it's the European Society for Human Reproduction and Embryology. So it's ESHRE and ASRM standards. But we also have our own moral compass, you know, our own belief system that at least in the United States, if a couple, most couples can engage in fertility treatment, but there's certain situations where we don't have to, or if, but there are rare circumstances where it's not normal medical treatment. It's just elective treatments that we can feel a little uncomfortable and decide not to help them. There's lots of interesting examples with that. But the 99.9% of the time, couples want to have a baby, and we're able to help engage with them and help them have a beautiful family.
Now, here's a question from last week, Doc.
Okay.
This was one of the questions that was posed last week. Do you know of fertility labs that sell frozen eggs or sperms or embryos? And are there any mechanism in place to prevent the illegal or immoral use of these cells or zygotes?
Well, we do have a standard of care, at least in North America and the United States specifically, that it's okay. It's governed by the federal government. There's regulations from the FDA in the United States, but it's okay to have donor egg banks or donor sperm banks, governed very tightly regulated system to have frozen eggs or frozen sperm that you can obtain, especially those that don't have sperm, or where the infertility in that the gentleman has no sperm, or if the woman is out of eggs. You can engage in these centers, and typically you have to use an infertility center to help you use those things, those products, either the frozen donor sperm or the frozen donor egg. So that's pretty straightforward. Now, where it gets a little interesting is donor embryo. So when the egg and sperm have already been united, it's potentially a life, an embryo. There are circumstances where couples have used the process, the science, to have their families, and they actually had some extra embryos in the freezer. But morally, they didn't feel comfortable with sending them out and having them destroyed, so they would donate them. So it's really popular right now to use donor embryo. It's a very affordable. It's one of the cheapest options we have, especially for couples where the woman's eggs supply is bad per se. And now there's some more laws governing that. So donor embryos, you can't, in the United States at least, it's kind of governed under some life laws or adoption type of laws, where you can't just buy donor embryos, because that's considered potentially a life. So like at a fertility center like ours in Orlando and Jacksonville, Florida, if a couple is interested in donor embryo, they can have a consultation with us, and we will show them what's available, and they're welcome to use any donor embryo batch that's remaining. And we actually give the embryos to them for free, but the process does cost a little bit of money just to do it, to put the embryos in their body. So that's why it's the most affordable, because you're actually getting the embryos for free. Because yeah, the laws in the United States are a little tough, where you can't sell embryos, which is where the egg and sperm have already been united and is potentially a life. Then you start getting into some interesting laws, and also it's not an adoption. There's a confusion in the United States. Couples that would like to pursue quote unquote embryo adoption, it's not. That's not the proper semantics. It's not the proper way to say it. Adoption's got its own definition legally, and using someone else's embryos is not an adoption. So we just call it becoming a donor embryo recipient. So if you choose that path, we call it a donor embryo recipient treatment plan. And but you'll hear people kind of sway that conversation around. They'll say donor embryo or donor adoption. Yes. And yes, so that's how that works.
No, Doc. I have a lot of questions on
Sure.
what you just said. So I'm trying to sort through a few things here now. The individuals who have the embryos frozen and no longer use them, you are indicating that they may give them. So there is the whole matter of donating.
Yes.
Now, if I want to have a child with my spouse, we can't get pregnant, and we choose to go the route of getting one of those donor embryos, then that embryo is implanted in the uterus, I'm assuming.
Yes.
And a normal pregnancy would take place, and delivery. In a case like that, I am asking now, of course, the baby genetically does not belong to me nor my wife.
Correct.
So in as much as you made the distinction between adoption, it's a natural birth maybe, but we can't truly say it's our child in the sense that it's a product, it's an offspring.
You bring up a really important part that I'd like to discuss, where I agree with you. Like when a couple engages in using donor embryo, yes, it's another couple's egg and sperm, but there's an interesting scientific finding. About 10 to 12 years ago, we've found an interesting process called epigenetics, epigenetics. Epigenetics. So the better way to describe that is when we put an embryo in somebody's uterus, and even though it's not genetically related to the mother or father using that embryo in that woman's uterus, we know the woman's uterus will actually signal the embryo to unravel differently to some degree. So like we know, for example, if the woman is carrying a donor embryo in her uterus, that woman that wanted to have this pregnancy, her uterus will actually, or her body will signal the embryo to unravel somewhat differently, making that a different person than if it grew in somebody else's uterus. So certain things that are controlled by the carrying woman, the woman carrying the pregnancy, are personality and intelligence, we have found, are not genetic. Now, we all have like a pride with that, but we actually have really clear science showing that intelligence is not genetic. So intelligence and personality are not genetic and can be influenced by the woman's that's carrying the baby. Plus, there are some physical characteristics that are influenced by the woman carrying the pregnancy as well. So when that woman grows that baby in her body for 10 months, 9 to 10 months, and has that child, it really becomes a different individual than if it were to grow in the original parent's uterus or another couple's uterus. So there is a difference made. Now, when that child is born, yes, genetically, it'll look identical to other people, so to the donors. But by, at least in the United States, the law is if you deliver that baby from your body, that's considered your baby legally. So on the birth certificates, through the legal mechanisms in the United States, if you have that baby and it's birthed through your body, either by cesarean section or a vaginal delivery, No, that's the legal mother, the legal parents for that child are at that point determined at that point. It's at delivery.
Now that's very interesting because I'm really interested in the relationship between the developing embryo and the mother, and you mentioned intelligence and that kind of influence there. Let's just talk a little bit about that. Even in a normal pregnancy where there is no donor, that period of development for the baby, that 9-month period of development, how important is that in terms of characteristics for the child, personality, etc.?
That's the right question, Dr. Greene. And we are now learning to measure this better and better. And if you think about it practically, when that embryo goes into the woman's womb, it's smaller than the fleck of dust. It's so small you cannot see it with the naked eye. So when we put that embryo in the woman's womb, you can't see it. And when she delivers that child, it becomes an 6, 7, 8 pound baby, what have you. We now know that her body signals that embryo to unravel differently and become different. And the woman carrying the baby has more influence than we ever thought. Just the environment, in that early environment when things are just developing. And for example, if the woman did something horrible like drink alcohol while she's pregnant, we know it'll be really bad on the baby's brain development and other physical structures. But just even simple things like the woman carrying the child, her mood, the food she eats, does have an effect on the baby. So there's more of an environmental effect than we ever thought. In the recent past, we thought it was all just simple genetics and that you could not alter these things. But now we're learning with intelligence and emotion and personality and lots of other physical things are very much influenced by the environment, and even more so at this early environment as the baby's growing in the uterus.
So now, Doc, this may be shifting just a little bit, but I want to stitch this in here because in our world today, whether it be in the Caribbean or in North America or wherever else, we do have the problem of teenage pregnancies, and some of these pregnancies, the individuals, the mothers, are immature and don't understand what is involved in that crucial period of nurturing that unborn baby. So this has implications for that.
Yes. And, we're not smart, we're not sophisticated enough to be able to measure it precisely, but I'm not sure if we have any measure or any comment where if it's let's say a young, immature woman with ignorance compared to an older woman with wisdom and intelligence, does that have an effect on we know it has an effect on the baby's development, but is it good or bad? I can't parse it to that level. I don't think we have enough knowledge to know if that's good or bad, or to what degree that matters. It's a great question. We do know, though, that at any level, things like alcohol or drugs could affect the baby. But I like your question. We're not quite sophisticated enough to be able to discern the differences from a younger, ignorant, immature woman or an older, more mature, intelligent woman in the effect on changes on that baby.
Permit me to ask one more question along this line. I'm still on the 9-month period. Is there anything that any studies that have been done as yet that reveal the impact of having a father present during that period versus not having one?
It's a great question. I know of no studies that look at the impact of a fatherless family versus a fathered family in regard to the baby's development in utero. There probably are good studies after delivery, in early childhood development, which if you could almost surmise that it has an effect on the woman while she's pregnant. But we do know other examples. It's a great question. For example, if there's an insult, we know between 6 weeks of pregnancy and 14 weeks of pregnancy, if there's an insult with alcohol or drugs or an infection, it has more of an impact on the baby's development than later in the pregnancy. So it seems to, maybe there's different phases. Maybe it's more important physically in the first quarter of the pregnancy that the woman's healthy and not exposed to toxins. And maybe the latter part of the pregnancy, when the baby's brain is developing, maybe it's more influenced by the woman's emotions, or a fathered family pregnancy versus an unfathered, pregnancy. Yeah, if that makes any sense. But we don't have any good data on that.
Okay, well, let's get back on stream, so to speak, because we're really talking about infertility and and that kind of thing. So in your response a few minutes ago, you indicated that the developing embryo from the donor is influenced by the mother who is carrying that embryo. Now let us explore this a bit more. We noted that adopting a child in the US could run in the region of 40 to 50,000 US.
Yeah.
I did some research
That's
during the week myself, and I discovered that using a donor embryo is much cheaper, you indicated. And I can see how that may work in the case of a couple who is married. What about the single person who wants a child? Yes, they may adopt, I suppose, and that would be fine. But if that person should decide that he or she wants to adopt an embryo, that you just indicated that that's
Yes.
not the correct term. But if he or she decides, I want a baby and I want to get one of these donor embryos, is it
Yes.
ethical for a single person to become pregnant?
It's a good question. And at least in North America, we have certain laws that we have to abide by, where that has to be available to married and unmarried desiring individuals. So we cannot now, but the doctor does have the freedom in the United States that if they feel uncomfortable with placing donor embryo into a single woman, they don't have to do it. They can say, I feel uncomfortable with the situation, and they don't have to do that event. But it is open and available, at least in the United States, where single women can use donated embryos. And taking it to another level, there are couples that come seeking the use of becoming a donor embryo recipient that don't even have infertility. So we have couples that will enter an infertility practice and ask to use donor embryo just because they feel that morally and ethically they're sort of adopting this child that needs a home. So they kind of perceive this as a crisis of these embryos that are frozen, that need a home and are abandoned. That's kind of how they perceive it. So it's very interesting that even non-infertility couples will use or consume donor embryo just for their feeling is that it's helping society.
Now I'm sensing that is to some extent like, going to an orphanage and saying, here are all these children who need a home. Let me take one.
Exactly.
I want to go back to the question of the embryos. Now, a couple who walks in, whether or not they have an infertility issue, and decide that we want one of these donor embryos,
Right.
maybe because they have the capacity to take care of that individual, whether the person is experiencing issues getting a child their own or not. But let's go to a lady now who, well, even before I do that, I wanted to ask about pregnancy and the definition of pregnancy, because if I have sexual intercourse with my wife and as a result she conceives, then we call it a pregnancy, and we generally refer to pregnancy as a result of sex. When you
Yes.
implant an embryo in a mother's, in a female's body, and that individual did not have sex,
Right.
Is that still pregnancy?
It's I have a complicated answer for that simple question. I love the question. It's very smart, Dr. Greene. How do you define pregnancy? And it's interesting, every country defines it a little different. And scientifically, it's considered a clinical, now there's different types of pregnancies. So there's a clinical pregnancy, which is kind of what you're alluding to, like a regular, normal pregnancy, clinical pregnancy. That can be from any means, from egg and sperm uniting, that embryo burrowing into the uterus, getting a blood supply from the mother. And once we can see it on ultrasound, or it's kind of at a 6-week stage, then we call that a clinical pregnancy. So it doesn't have to be derived from intercourse. It can be from outside the body, inside the body, and placed inside the body. And the reason that's important is there's confusion where there's a special type of pregnancy that's a cancer pregnancy. I don't expect you to know this. This is very kind of interesting. We see it regularly, but there's something called a molar pregnancy, which is a cancer type of pregnancy. And there's another type of pregnancy called an ectopic pregnancy, where it's in the tube. And there's an early pregnancy called a chemical pregnancy, where it was just positive pregnancy test, but you could never see it in the uterus. So we don't consider those viable clinical pregnancies. And those are actually dangerous pregnancies that could kill the woman. For example, a tubal pregnancy or ectopic pregnancy will burst and she'll bleed to death internally. Or if it's a cancer pregnancy, like a molar pregnancy, it'll kill her. It'll spread throughout her body and her brain. So we take it one step further on how we define pregnancy. Is it a clinical intrauterine pregnancy, or is it a harmful pregnancy that could kill the woman? I don't know if that helps you in that definition, but outside of intercourse, no, we still consider that a pregnancy. If it's in the laboratory where we place a sperm into the egg, and you have God-given sperm and God-given egg, and it becomes a God-given embryo, and we still consider that a pregnancy and a life potentially, but only after that 6-week or 8-week stage of development in the uterus can we truly say that that's a viable clinical pregnancy. I hope I didn't confuse everybody with that.
I don't think so at all. That's very interesting. I'm tempted to go some more into that, but let me say that.
Let me say one last thing, Dr. Greene, just to help. Like, for example, in the state of Ohio, in the United States, they were trying to make it illegal. And I understand, I'm a pro-life person all the way, but they were trying to make it illegal to treat a woman that has a tubal pregnancy, or what we call an ectopic pregnancy. There was non-medical people that were making decisions, and they thought that, hey, they said, well, we want to make it illegal to treat that tubal pregnancy because it's in the tube, and is there some way that you can remove it from the tube and put it into the human's fallopian tube and put it into the uterus? But there's never been a single case of that ever in the world's history that was successful. So we know that only if it's in the tube, it can only be harmful and potentially kill the woman. So we have to treat those medically, and unfortunately, they have to be they die. Those pregnancies will die because there's no way from the tools that God has given us to help that pregnancy become a life.
Just so that I follow you clearly, are you saying that there is an argument to say that this is a pregnancy and should not be destroyed?
Correct. And so they were trying to protect ectopic pregnancies out of ignorance, and there's no way to make an ectopic pregnancy a viable baby. They only potentially will kill the woman carrying the baby.
Okay, wonderful. I'm glad it didn't pass.
Yeah, I don't believe it's passed, but yeah, and I think they did listen to advice ultimately that how do you define this pregnancy and yeah.
Yeah. Now, Doc, I do understand. As I said before, a single lady going into an adoption agency and saying, "I want to adopt a child." I can stretch my imagination to go beyond that to say that a single lady may decide that she wants a donor embryo. But I think, and of course there are ethical issues there, but I think it gets more complicated now when here's a lady whose husband is not producing any sperm.
Correct.
They want to get pregnant. Do they get a sperm from a donor or from a sperm bank? And in that case, what we have now is a combination of the woman's egg with another man's sperm.
Yes. So it's a good question. And we do have that scenario quite often where the gentleman was born without sperm or had trouble and had surgery or cancer and had testicles removed or had chemotherapy that killed his sperm. Then we can use donor sperm either in the form of an insemination where we place the sperm into the woman's uterus, or use that sperm with her egg with IVF. And then it creates an embryo and we place it into her uterus and she can they can create a baby that way. Yes.
So the ethical dimensions there now would be, how do we define sex? And now, of course, I'm speaking from a Christian perspective because,
yes,
there is a prohibition for a married man to have sexual intercourse with another woman
yes,
outside of his wife, etc. But
right.
now we're having the fusion of sperm and egg, and that now going into the body of the female.
I think I can answer that question. Sex is the act of a penis, and sex is the, excuse me one second here, let's see. Sexual intercourse is the act of a penis ejaculating semen into a vagina. And then that sperm leaves that semen into the woman's womb, goes into the fallopian tube to find the egg and conceive. Now, in the old days, there was something called traditional surrogacy, where if the woman could not get pregnant, they would use another man's sperm this way. So that's called traditional surrogacy, when you have sexual intercourse with another man, but just placing another man's sperm into the uterus is not considered sexual intercourse. And I don't know if I've never heard of that from any legal definition with Jewish definitions or Catholic traditions that's an act of infidelity. So it's more of the act of sexual intercourse and not so much the actual sperm being used with the egg.
Okay, we will take a question or two from our audience. As we indicated, there were several questions we did not get to last week, and so we want to look at a question here. Is there a black market for the illegal trade of these frozen cells or embryos? Also, how about labs that are attempting to use these cells to...
Yes, we've never heard of any illegal use of egg or sperm in somebody else's body, or illegal trafficking of sperm or egg. There have been some instances where a scientist would, without a parental involvement, try to use an egg and a sperm to make stem cells without the permission of the consenting sperm donor or the consenting egg donor. There are circumstances, and it's happened in Mexico and a few other countries, where it was considered illegal or improper to create life for other purposes, other than intending to have a child. So this is where we get into the dilemma of stem cells, creating stem cell cultures, and who owns them? What is this the proper use of sperm and egg outside of intending to have a baby? So it can get very controversial this way.
So let me ask, what if they should decide now, because, or is it, clarification, is it that when you do fertility treatment to an individual who cannot naturally conceive, do you always end up with a number of excess?
It's a good question. And no, most fertility centers, when a couple goes through a fertility treatment, the majority of the time they just have enough embryos created to put into their uterus in that fresh real-time month and not have extras to cryopreserve. So the majority of centers, there are not an abundance of extra embryos. But only select centers, I think we're one of probably 8 to 10 centers in the United States that routinely has extra embryos for the couples to use. And there's a benefit to having extra embryos cryopreserved for if the couple goes through the process of IVF and they don't get pregnant, they'll wish they had extra embryos to use so they don't have to go through the costly IVF process again. It's so much cheaper and much easier to use frozen embryos in efforts to have another baby. Or if they had success on their initial attempt, they come back years later to have another baby. They don't have to go through the costly experience of IVF, and they can use their cryopreserved embryos to have a second or a sibling for their first child. And that's, for example, at our fertility center, I think we have one of the best success rates in the world that way, where couples come in, they'll go and have to proceed through an IVF cycle, which we've made very affordable here, but they generally will have extra embryos for a second attempt or a second baby, and have their whole families from one egg retrieval, which is wonderful. And that's one of the big pressures we have to deal with is in the cost of IVF, and most couples can't afford it at all. So if they can go through one IVF cycle and get enough embryos generated for one baby or 2 or 3 children eventually, not all at one time, there's benefit to that. So we're one of a select group of centers that actually have an abundance of embryos from when couples go through. But we can also tailor it. Like if couples morally and ethically say that, Dr. Brown, we really don't want any embryos in the freezer at all, we can do that as well, where we can only fertilize maybe 2 or 3 embryos for them to put into the body and not have extra embryos cryopreserved or have life frozen at all. And then there's the option of just freezing the eggs. It's not quite as good to freeze the egg compared to freezing the embryos, but they're pretty close these days. So if a couple does not want an abundance of embryos in the freezer, they can just freeze the egg. From discussing this beforehand.
Now, last week, I think we did say that when eggs are frozen, I'm using my own terminology here, but they tend to have a shelf life. In that eggs that are used earlier stand a better chance than eggs that are used later. Did I get that correct last week?
Sort of not. So now, once it's the woman's age that matters. So when a young woman, we'll say a 25-year-old woman, has frozen eggs in the freezer, they never age. Once they're in the freezer, there's no freezer burn. They're good. We have evidence now that it's good for probably 50 years, that they don't degrade, they don't degenerate, they don't become bad eggs. So they're frozen in time. It's really remarkable that we can do this. But if you have a 40-year-old woman who freezes her eggs, those eggs don't do as well. Like anyhow, even in a fresh cycle. So if you freeze them or cryopreserved eggs or embryos, they're frozen in time. There's no negative effect from being in the freezer. But back, I think we're kind of hitting at the egg freezing story, which is very popular for women under the age of 38. If they would like to, for fertility preservation, if they're not ready to have a family and they think in the future they may marry or they would like to have a family, for women under 38 years of age, it's now no longer experimental. It's recommended that they would freeze their eggs, go through the IVF process, get their eggs, freeze them at under age 38. And then if they find the spouse that they would like at age 45, when their eggs are bad at 45, they won't make it, their eggs at 45 won't make a baby 99.99% of the time, they would thaw those 37-year-old eggs and use his sperm with those eggs, and the pregnancy rate in that 45-year-old woman would be as if she was 37, which is much, much better than 45. So there's not a shelf life. I think they're frozen indefinitely. They're good indefinitely. But it just depends on the age of the woman when you froze them. That's the key ingredient. Where we know 40-year-old eggs are not as good as 35-year-old eggs.
Okay,
and it's yeah.
I'm getting you clearly.
Okay.
Now, Doc, let's go to another question because again, time is going.
Sure.
This is an individual saying I was recruited to donate my sperms for money by a sperm bank as a student in the 80s is this South Carolina, it looks like. Yes. I rejected and well, I'm not sure if it's South Carolina or SoCal. It says SoCal. I'm
Carolina,
assuming
probably.
it's South Carolina. Anyway, I rejected and some accepted. Is this still a common practice today? What are the ethical implications? So let me read the question again. It says, I was recruited to donate my sperm for money by a sperm bank as a student in the 80s. And the question is it still a common practice today? And what are the ethical implications?
That's a good question. So, yes, so there are large sperm freezing centers where they like to procure men's sperm, cryopreserve it, and offer it out to couples where the gentleman doesn't have sperm, or in situations where donor sperm is necessary. So in the United States, we're kind of this is very regulated by the FDA, the federal government, and there's certain criteria. For example, you can't anonymously donate your sperm if you have family genetic abnormalities such as cystic fibrosis or sickle cell disease, any heritable genetic diseases, or if you have infections, like if you've had gonorrhea or chlamydia, or risky behaviors like intravenous drug use, they'll choose not to cryopreserve the sperm, and it doesn't meet the criteria to freeze that sperm for anonymous use later from a couple. So there's criteria the FDA makes all of these groups go through, and they select out for very low risk infectious disease individuals and low risk genetic disease individuals, and they'll cryopreserve the sperm. And that's available in these large banks, such as Zytex out of Atlanta, or Fairfax cryobanks in Virginia, or California cryobanks in California. And there's one in Orlando called Cryos is the name of that company. So these are all any company that's engaging in business in the United States that procures or sells donor sperm, they're under some serious scrutiny from the government. So they're very legitimate. But when you get into the ethics and morals of it all, there's a religious definition. For example, with Catholics, anything outside of intercourse is unacceptable. So inseminations with donor sperm or even a husband's sperm is unacceptable. IVF is unacceptable to Catholics, where for general Christians or God-believing people, there's nothing in the Bible against this. Jews have their own rules, the mikvah rules that you have to follow. So every religious group has a different set of ethics and morals, and but generally most are accepting. Those that want to have a family where the gentleman does not have sperm, most groups are, except for Catholics and Muslims, are accepting donor sperm inseminations.
Let me ask Doc, again, do you, for the individual, or even the married couple, for that matter, whether they're married or single, I mean, they want to have a child, they cannot get one of their own. They're going to use a donated embryo. Do they get information on the characteristics of the donor?
Yeah.
So they're able to decide, I want this one, I don't want that one?
Yes, that's a great question. So, with donor sperm or donor egg or donor embryo, absolutely, they're given the height, the weight, the ethnicity, the medical background of these individuals. They do have access to that information. It was their genetic screening of those couples, and oh yes, there's transparency with that is very strong. It's actually mandated.
What about the ability to select the sex?
Yes, so that's now gender selection. This is a hot topic morally and ethically as well. So there was a process where you could wash a man's sperm a certain way, because it's the sperm that generally determines is it a boy or girl. There's X sperm genetic with the X chromosome, and there's sperm that has a Y chromosome. So it's generally not the egg that determines the gender of the baby, it's the sperm. And generally speaking, when a man produces sperm, 50% of it will be male and 50% will be female potential sperm. And in the United States, for a while, there was a sperm separating technique where they would kind of try to separate the sperm with interesting techniques to try to get that. And then they would place that sperm in the woman's uterus and tubes and try to help her get pregnant with insemination with gender separated sperm. But the success rates weren't very good. And the few companies that tried to approve this in the United States, they did not get approved because they weren't as reliable or reproducible enough. So now pretty much most couples, at least in North America, for gender selection, if they want to do gender selection techniques, for example, for family balancing, if they've had 4 or 5 boys and they want a girl, or if they've had 5 girls and want a boy, it is available for them to test the embryos to see which ones are the boys or which ones are the girls. And also the test will tell you if it's a normal one or not that could potentially make a pregnancy. So when they do this, it's called PGS testing, or by today's definition, we call it PGTA testing, where we can test the embryos before we put them back in the woman's body and tell you which ones are the boys that appear to be normal chromosome set and which ones are the girls with the normal chromosome set. And then use those in the woman's body to have a boy or girl. Now, this is the hot topic, should this be allowable? Is it acceptable? And this is the hot topic. And to me, as I'm a very much a God-fearing, God-believing individual, and from my own set of morals and ethics, I'm okay with it. I think God gives us the ability to do this, and is it right or wrong? Now, the issue is, what do you do with the ones you don't want? So the big question is, let's say you want to have a girl, and you go through IVF with genetic testing of the embryos, and you have some girl embryos, and you use them, and you have girls. But what about the unwanted normal boy embryos? To me, that's where the ethical dilemma is. Are you going to destroy those embryos? Are you going to donate them? And for example, at our fertility center, we if the couple says they're going to destroy their excess embryos, we don't treat them. It's a mandated policy at our center that if they want to do family balancing or gender selection, that they have to plan to either they have to donate the extra embryos, or we will send them to a different fertility center for treatment, because we don't believe in destruction of embryos.
So we had a question on stem cell earlier, and we're talking about donated embryos and excess embryos, whether it be for gender selection or otherwise. But yes, the excess embryo, for the individual who says, listen, these are excess embryos, can't we use them for stem cell research? What's the ethical dilemma there?
Yeah, it's there is a dilemma. And the issue these days, we used to ask patients, do you want to use your embryos? Do you want to donate them to another couple, or donate them to science, like where they could use those for stem cell creation? there's not any currently in the United States that will accept these embryos because there's laws in place where we can't do that like they did 20 years ago. So it's really not happening. But in other countries, it probably is happening, where they're using these embryos that were intended to make a baby, and they treat them in a way where they become sheets of cells for stem cells production. And it's not really available right now in the United States, at least, but in other countries, it probably is available. There is probably the ability to do that, to donate your embryos to stem cell research or the science of developing stem cells for, and the argument with those morally and ethically was, well, at least those cells are going to treat humans, like it could help them with a repair a knee or a burn victim to make skin. There's a lot of benefit from stem cells to help currently living people, but it does disrupt the intent of that embryo was to make a baby. So that's where the tough questions and answers come from. Like, is that ethical and moral to take this embryo is intended to make a baby and make it something else, but even though it's good for existing life and people that are living, is it acceptable? That's the hard question.
Okay, interesting. Someone is asking, what is our position on the technology for having pregnancies without sexual intercourse? Now, we do have
especially with the Adventist feeling is that it's okay to pursue assisted reproductive technology, but actually donor egg and donor sperm is reasonable also, but the question and also then it gets difficult, like, is it acceptable in the wed couple or unwed couple to use these products or to use these services?
Yeah, we actually have a very clear statement on it. Well, I shouldn't say very clear because, there are those gray areas. The church does say that, for married couples, that's permissible. The issues become now when the person is single, when the person is not married. So that if a person turns up in 2 weeks' time and says, listen, I'm pregnant, but they're not married, then how do we deal with that? And what the church does is that it simply says, you want to be very cautious and you want to get very clear counsel before you proceed with something like that. But for the married couple, it does give the green light, should I say, for married couples to go ahead and do fertility treatment and get pregnant with the use of the available technology.
Yes.
We have, if we count from when we started, for 1 hour, Doc, we're going a little bit, just a couple minutes over because we started late, if that's okay with you. And I want to ask you a couple more questions.
Sure, absolutely.
Yeah. So here is an individual asking, at what stage do you make the determination that the developing embryo can be used for stem cell development and is not considered a new life form? You may have responded to that already.
To answer that, we don't do it at 99.99% of fertility centers. We don't engage in stem cell procurement or processing, and I've never done it. I've actually never seen it performed. But it would be very early on. So early, when the egg and sperm become an embryo, and after 5 days or more of growth, at that point, they could treat that embryo and make it grow differently and immortalize it and have it grow in sheets, and they chemically treat it. But it's really early on. It would be, I think they use day 5 embryos for that production, but it's not done in the United States anymore, and I'm sure it is in other countries, but I think it's at that stage that they treat those cells differently, and they're still alive. The cells that would have made the baby are still alive, but they're growing in a different pluripotent state. They don't become like skin cells or eyeball cells or head cells, and it's interesting, but it's fraught with a lot of moral and ethical questions. Absolutely.
Final question for today, Doc. This question is, what are your views on LGBTQ couples receiving sperm or an embryo in the context of what we believe male-female Bible-based Christians? I know it is a tricky subject to talk about LGBTQ,
Yeah.
but
Well, the way I like to answer it is, you know, I know that legally I have to treat these individuals with fertility preservation techniques. I know that legally, in the United States, if somebody wants to potentially freeze their eggs or freeze their sperm before a sex change operation, I have to offer that. So there's ovarian tissue cryopreservation, there's sperm cryopreservation before they have sex change operations or what have you. I have yet to work with any of these individuals that want to use those to have a baby later in life. And this is kind of a new thing. So it's early. There's not many centers that have experience or the consent forms for this. It's kind of in its early, and a lot of fertility centers haven't decided yet. I think most fertility centers, we love God-given life. We think life is beautiful and wonderful, and how that life comes to be can be complicated. So there's not a whole lot of, we don't have a whole lot of instruction on how to handle these complex situations. But I know we're in favor of life. We don't believe in, most of us are very pro-life. We believe in God-given life, and we protect it and are humbled by it. So I guess that would be my statement.
Well, thank you so much, Doc. Now, sometime in the future, if you are so willing, we would be happy to have you back, because we did not get a time at all to talk about surrogate motherhood and how that works. And I really wanted to touch on one of your expertise, that is tubal reversal.
Yes.
We do have a program coming up in a few weeks' time on contraceptive devices, and when we discuss the whole matter of the tubal litigation, it would be nice to have you talk about that reversal process. So we trust that you would be kind enough to consent to join us sometime in the future. But I do want to say that we are truly very grateful for the wonderful wealth of information that you have shared with us, and we really do appreciate this.
Dr. Greene, it is definitely my privilege. And sorry, 1 second here. It is definitely my privilege, and I would be very available to help at any time you desire to talk about surrogacy, tubal reversals. Would enjoy it.
I appreciate that. Thank you so much to all of our viewers out there. We are delighted that you did join us. For the next few weeks coming up, just to share some of the topics we're going to be discussing here on Let's Talk. We're going to be talking about infidelity, not infertility now. We have just discussed infertility, but we want to talk about infidelity. We want to talk about, who's to blame for infidelity. Is it the man? Is it the woman? We did promise that we're going to go back to the whole matter of legal issues in a Christian. And going into December, we want to answer that question with respect to the celebration of Christmas and what's our views on that. So those are just some of the topics we have lined up. We're also going to be talking about the matter of euthanasia and whether it is right or wrong to pull the plug, etc. So please join us. And as we indicated, we have this discussion on contraceptive devices, the ethical dimension behind it, and Dr. Brown will come back to talk to us about tubal litigation and then surrogacy. So it was a delight, and we trust that you will join us next week again, viewing audience. Dr. Brown, once again, thank you so much for having us. Thank you so much for being here. And I trust that your business will continue. Just in the event that some persons join late and they want to know how to contact you, I'm going to give you the opportunity to say that again.
Yes, please. If anybody has specific questions, we'd love to entertain them. Our office number in the United States is 904-260-0352 to set up a telemedicine or phone consultation. We're at brownfertility.com in Orlando and Jacksonville, Florida. God bless and have a great week. Thank you.
Thank you so much. God bless all of you.